I can start.
Good morning, everyone. My paper is on an online survey of parent awareness about ocular health of children. As we know, 1.42 million children suffer from blindness globally, and the prevalence of blindness and visual impairment is about 5 times higher in developing countries compared to developed countries. And in India, the prevalence is estimated to be 0.8 per thousand population. It can affect not only social, intellectual, and psychological development, also their academic performance and quality of life. So, in the long run, it can affect the economic status of the family and country. Amblyopia, which could be due to uncorrected refractive error, strabismus, or media opacity. A delay in this diagnosis and treatment can lead to permanent loss of vision. Childhood blindness is the best corrected visual acuity of less than 3 by 60 in the better eye or a corresponding visual field loss of less than 10 degree in a child less than 16 years. My objective was to assess the awareness of parents about pediatric eye examination with the aid of an online questionnaire. It was a school-based cross-sectional study. The online questionnaire was prepared in a Google form by a pediatric ophthalmologist trained in long-term pediatric ophthalmology fellowship. Awareness about eye examination and spectacle were 10 questions. Pediatric cataract 2, squint 4, and amblyopia 1 were included. The completed total number of responses were 84, and 84.1% response were from the mothers. The mean age of the parents was about 34.3 plus or minus 3.5. This is the social demographic data. Many of the parents were high school and above level. And coming to my results, almost 66% of parents believed that routine eye screening should be done at birth. Though majority, that is about 72% knows that routine eye screening is mandatory before 3 years of age, only 12.2% and 19.5% children underwent eye examination at 1 year and 3 years of age respectively. 7 out of 8 children have not undergone an eye examination even before 5 years of age. Regarding squint, about 50% of parents believe that the squint can affect vision, and 8.3% still possessed the thinking that squint is a sign of luck. Almost 28% believed that squint did not require treatment. Coming to congenital cataract, about 35% of parents didn't know that cataract can affect children. And there were almost equal responses regarding medical as well as surgical treatment regarding congenital cataract. Amblyopia, the person who knows about the term amblyopia was about 70%, and more than half of these got the knowledge from the ophthalmologist. 23.1% each from social media and print media. Only a very few acquired their insight from friends or hearsay. So coming to discussion, though majority of parents were aware of the age of eye examination, most of their children has not undergone an eye examination by 3 years of age. Refractive error being the commonest cause of visual impairment in children, parents are still reluctant to prescribing glasses to their children. Wearing glasses is still considered as a social stigma by a class of parents. There could be multiple factors like lack of awareness, poor socioeconomic status, low educational qualification, distance factor, and a lengthy eye examination and poorly cooperative child. These are the barriers. So in our study, 94% parents were educated with qualification above high school level. In a state like Kerala, where maximum literacy exists, our study shows that 83.5% routine examination was not done even at 5 years of age. So we should endeavor to find out the causes of indifference on the part of parents or to taking their children for eye examination. So parents have increased awareness about the eye examination in children compared to past, but they were not regular in getting their children for examination. So we need to think the causes for this behavior and educate the parents properly. Thank you.
Dr. Ramya, was it a part of a thesis for a postgraduate or it was just a study?
No, I just studied that.
Okay, now tell me a very important thing. Somehow it looks like a kind of a case of a reverse engineering. You have probably started with the conclusions in the beginning itself. Like, I really did not understand what is your research question. Number two, how did you validate your questionnaire? Who made the questionnaire? And what was your process of validation? There is a very clear cut in research methodology. You just can't prepare a questionnaire yourself.
Okay.
A questionnaire has a very valid steps of, some well-known steps of validation. there are 3 or 4 different types of validation. There has to be at least minimum 2 methods of validation that has to happen. So how did you validate your questionnaire? Who made this questionnaire?
I only have prepared the questionnaire and I have consulted with a research methodologist and
No, not research methodology. Research methodology, your statistician, they don't make questionnaires. What I'm saying is a questionnaire has to be validated. So, did you say non-validated questionnaire?
okay.
Okay, that will have a very low impact or very low, research impact value, because there are some very clear-cut ways of validation. At least the simplest is you have to do a pilot study, because when you answer a questionnaire, you can find out. For example, you told about 70% of people knew about amblyopia, or
Know
they didn't
about the term amblyopia.
exactly know about the amblyopia
Yes,
term.
yes,
That's
yes.
what I'm saying. So, which is very, very surprising. So even if you probably ask 70% of MBBS doctors, they may not know, 70% may not know amblyopia. That is the stage of situation. So 70% of parents knowing amblyopia is little, because the question that you have made,
Maybe the
do you know
leading
about
questions.
amblyopia? They will sometimes, when there's always a bias when answering a questionnaire, they will say yes,
Yes.
because you didn't ask them write about amblyopia in full page. You're not asked. So they may say yes. They would have heard, or it looks as if they have heard it somewhere. And also you said, is it a sign of luck? Then they will suspect that probably it is not luck. So they may say no. So there is some kind of a bias that comes in. That's why you need to run a pilot, then validate the questionnaire. Then there is what is called peer review. You need to send it to at least 3 people. Like if you send it to Dr. Sandra, let's say, she will definitely find some of the questions can be framed differently.
Okay.
Okay, so this is how the validation can happen. There are many other ways, but this is something. So, what exactly you have added to the literature? Your study has told what is new, or have you reinforced the old thing, or has it added anything new from your study?
I believe that routine eye examination should be done at least 3 years of age before the child entering into the pre means Anganawadi. So here, even though parents know that it should be done, but many of the children has not undergone an eye examination. So that we should.
Things to add. So the way it was done was through a Google form, right?
Yeah.
So when you send a Google form, what prevents the parents from Googling the answers and writing it? And then how do you get a knowledge on what is that, whether it's correct or not? Yeah, so it's a Google form. So you're just sending it to them. So they can just find out. And yeah, it is very easy to just type in the term and then answer the questions.
I have given an introduction that it should be means whatever you know only, because you should not means it should be totally honest your opinion. Yeah.
That makes it more that they might do it.
And actually, this Google form is prepared, and I have contacted the headmistress and head teachers of the schools, and through the WhatsApp in their group, I have put this questionnaire. That's how it is done.
Secondly, so for that, see, the other way can be just like you can have some timed questionnaire. There are certain, apart from Google, there are certain ways in which you can have a timed questionnaire. You can see the way they are, the fastness which they are answering.
Okay.
So that way you can, like, some idea you can get whether it is correct or not. Secondly, whether there is an urban-rural difference in the parents.
This is done in a rural area only, not an urban area. Rural means it's not. I have prepared in both English and Malayalam.
I think the number of sample size is too
It's
small.
slightly less.
Yeah.
Yeah.
It's too small for
Yeah,
questionnaire.
yeah.
Should be around 500 minimum.
Yeah.
One class you will get 8.
Yeah. Only completed responses were only this much. That's I have included it.
Forward and use this as a pilot,
Okay.
and then you can take it forward, and then let's.
At least you should have 1,000 responses to make it really valid, because 84 is too less a
Yeah.
number for a questionnaire based, sir.
Okay, sir. Thank you.
Okay.
Thank you, sir.